Who among us has, at one time or another, tried some kind of a weight loss program?
I've tried it.
I tried it.
You didn't? I tried the Atkins. I didn't make it to the afternoon. I needed carbs.
Yeah, but can't imagine you ever needing a weight loss. You need a weight gaining
No,
program,
not just
if
weight
anything.
loss, but just physically fit. Trying to get physically to be a specimen, Jack.
Well, Dr. James Pinckney II, known as Dr. James, the medical expert, joins us right now. And Dr. James, I understand your contention is that most commercial weight loss programs aren't backed by scientific evidence. Explain.
Yeah, that is true. A recent study published in the Annals of Internal Medicine showed that of the 32 commercial weight loss programs in this country, only 11 have been studied utilizing a randomized controlled trial, which is our gold standard to evaluate programs.
Now, are you talking just about the TV shows that we see with I don't know if I should or could mention any of the names of the programs, or are you also talking about the big fads like P90X or HIIT and that kind of thing? Are they paired with food or dietary plans?
Mainly just the dietary plans, so excluding P90X, which are more fitness plans. Just weight loss programs based on food. So,
what are some of the successful ones, Doc?
Yeah, so it showed that 2 diet programs were successful: Weight Watchers and Jenny Craig. And by successful, I mean that the people who used the programs lost more weight after 12 months than people following their own diet.
So it's Jenny Craig and which other one?
And Weight Watchers.
You know, I remember Time Magazine, though, a few years ago, quite famously, they got a lot of attention for this cover story. They called it the exercise myth. In other words, it was the food that you ate. It had nothing to do with the exercise as far as the weight loss and what you look like.
Well, I think they're both very important. And yes, I'd say people can lose a lot of weight just by changing their lifestyle with diet. However, for your cardiovascular health, for your arterial health, exercise is extremely important, and all the studies are showing that interval training is the most important aspect of exercise. So basically varying your heart rate, going 50% of max, then up to 90% of max, and back down to 50 several times over a 22-minute span is giving us the most bang for our buck when it comes to exercise.
Now, explain how you do that. I mean, give an example of how you can do that, do the interval training.
Sure, you can do it with any aerobic exercise. So when I counsel my clients at Diamond Physicians, I say, what's your favorite thing to do? Is it swimming, running, on the elliptical? And let's take running, for instance. So you're on the treadmill. I want you to warm up for 4 minutes, and then I want you to go up to 90% of your max. So 100% would be a full-out sprint on the treadmill. So 10% below that for 60 seconds. Then go back down to 50%. So a nice light jog for 2 minutes, and then back up 90% of your max for 60 seconds. And you just do that. You repeat that for 5 to 7 times, and then all of a sudden 22 minutes have gone by, and you're really going to be burning fat and on your way to a healthier lifestyle.
I'm tired already.
That sounds kind of like what the HIIT workout is, as far as I understand it.
Sprinting on a treadmill is very difficult. I
Now, you can speed it up.
You don't have to be on a treadmill. You can be outside on the track. You can do it with swinging laps in the pool. You can do it on the bicycle. So it doesn't matter the modality, just that heart rate variability, which is the most important thing. And I want to make one more point about the foods. Now, Jenny Craig and Weight Watchers, they only had a 2.9 and 4.9% weight loss, respectively. So if you're a 200-pound person, that's only about 10 pounds over a year. That is very modest weight loss, and these programs can be expensive. So I really want people to focus on lifestyle modification with food and exercise, and tailoring that to their own particular lifestyle, because you can try one of these diets, and if it's not sustainable for you, it's not going to work. You're going to gain all the weight back and maybe even more.
You have a website that people can check out this information?
Yeah, you can go to our website, diamondphysicians.com. We have a lot of information about our Diamond 360 program, which is clinically proven to prevent heart attack, stroke, and diabetes. I've had clients lose 70, 80 pounds on our program, and we've talked clients out of gastric bypass and gastric sleeves and lap band procedures and helped them lose weight without surgery.
Again, what is the website?
DiamondPhysicians.com.
Diamond Physicians?
Yep.
Yes, sir.
Okay, diamondphysicians.com. And Dr. Pinckney or Dr. James will call you here. Thank you for joining us this morning on AM Tampa Bay.
Thank you.
Doc.
Oh, you're welcome. Thanks for having me on the show.